we think maybe it's possible we might have had this virus. What's up, guys? Scott here. Hope you guys are all safe and healthy. I hope you're all sheltering at home and observing the social distancing rules and staying inside as much as possible. I'm just checking in. It is day 22 of Life in Sweatpants. We're doing fine. We had a little scare this week. Susie got sick for a couple of days.
Hurling!
But she never had a fever, and she's feeling fine now, so there's probably nothing. But we took precautions and tried to keep her away from the kids and myself. But we're okay. Work is still going well, still working from home. I'm exercising every day with Barkley. We go for our hike. Luckily, we do have a yard where we can go outside and not have to interact with anyone. I did help a neighbor this week whose car stalled. I jumped her car. Probably didn't observe the proper social distancing rules, but she was stuck and she needed a jump, so that's what I did. And then I came home and washed my hands and did all the things you're supposed to do, and hopefully everything's okay. Let me go outside for a second, just get some fresh air. I've spent so much time working here over the last 3 weeks in this office. It is definitely nice to be able to go outside and get some fresh air. So let's do that right now. All right, so we're outside on the back porch here. It's a nice day, and I'm very happy that we have this house. And where it is, in the woods, we're surrounded by trees. You can't see my neighbors anywhere. I mean, there's some neighbors through the trees down there. I think you can see them there, but that's pretty far away. That's about as close as people are. So all the crap I've been given by people I work with, how far away I live, well, right now I'm super grateful that I chose to live out here. We have a built-in social distancing buffer protected by the trees. The first video in this series, I talked about how I haven't made a video in a while because I was really, really sick. I had a terrible cold a couple weeks back in January, which I still have a little nasal drip from, so hopefully that doesn't make me susceptible to the current COVID-19 situation that we're going through. I've been discussing it with my friend and coworker who was also sick. We think maybe it's possible we might have had this virus back in January. I went to the doctor 3 separate times and they told me it was a cold, but it didn't feel like a cold. And I just remember the last time I was complaining, like, I am running out of breath when I walk up the stairs. I can't take a deep breath. Every time I took a deep breath, I would cough. And every time I would talk, I would cough, just uncontrollably cough. And it was just like, I just didn't want to talk to anybody. I didn't want to talk at all. I still went for my walks with the dog every day, but it was just a struggle for me to like take a deep breath. Like I couldn't get a full breath. So I'm not sure, because you can't really tell. Speaking of the dog, where is he? Hey, Barkley. Hi, say hi to everybody. Hi. And I've been looking and having the time to research during all of this quarantine time. I've been researching and trying to see, like, how could you tell if you already had it? And there's no way to know if you had it or didn't. But looking at the symptoms and how they can present from as simple as a cold, which is what my doctor thought 3 times, like, she was like, it just seems like you have a cold. And I was just like, it's not a cold. It doesn't feel right. I can't breathe. Like, it felt like someone had their hand on your chest and was pressing you, like holding you down, you know? And it just didn't feel right. And it took weeks, like almost 2 months for that cough to clear up. So I have no idea if I had this. I'm going to act like I didn't have it, and there's no test to say if you had it or didn't have it. But if I did have it, the good thing is everybody in my house has been exposed to it and is fine. But I also remember that at work, there was a week or two where everybody at work was out. It seemed like there would there were a dozen people at work that were out. And I know that my producer, the person she shared an office with, he had it, she got it, I got it, our supervisor got it, and probably most people in the office at some point had this really bad cold, and they all took days off to like recover from it. So it was just an odd thing at the time. It's like, wow, that's a really strong cold that's going around. But maybe it was this virus. I don't know. And I guess we'll never really know unless they develop a test to find out if you have the antibodies to prove that you've had it. When that test gets invented, I'll probably take it to make sure. But for now, I'm going to pretend that I haven't had it, and I'm going to proceed with caution, as we all should, and stay inside as much as possible and stay away from everybody. But that's my story. It's something that came up this week, and I was just like, this is really interesting. Maybe because it was back in January, and I got my inhaler on February 6th when I went to the doctor. It's very coincidental, and I'm just, thinking, maybe. So on one hand, that's really good news, because then everybody in this house and everybody that we've interacted with and I've accidentally interacted with during that time when no one knew about this virus, maybe they've already been through it and they're fine. But if I did have it and didn't know, I may have accidentally infected other people. So it's one of those things where you're like, you just don't know. Everything reading, you could feel fine and be spreading this all over the place. So for all the people who are still going out and like, this is not going to stop me, I'm going to keep going, cut it out, because that's how this is spreading. You're just going out, and because you feel fine, like, why should you stop and stay home? Other people are getting sick. You might not present with any symptoms ever. Susie never had any symptoms ever during the time that Maya and Marcus and I were sick, and she was fine the whole time, but you just don't know what the effects are. So you should really listen to the CDC and the World Health Organization and stay at home, keep a distance, wash your hands, and now they want us to wear masks. So wear a mask. Don't go buying the medical masks. The medical professionals need those. Get a bandana or a cloth mask, or Susie made masks for everybody in the house. And it's just take care of each other. We clearly need each other, because at least in the United States, the federal government is not helping. And they don't have any plans to help. And I just watched press conferences where they're going to wait and see how different states who have been asking for medical equipment are going to do, because they should have prepared on their own. So the government here has told us, you're on your own. So we have to take care of each other right now, and let's just stay home, stay safe, and keep each other healthy. All right? Wash your hands, follow the rules of the CDC and the World Health Organization, and we'll get through this together. That's it. I rambled long enough. We're fine, and I'll talk to you guys soon. All right? Stay safe.